For women dealing with irritable bowel syndrome with constipation, IBS-C, Zelnorm 6 mg tablet, also known as tegaserod, can help alleviate symptoms such as belly pain and constipation. It works by increasing the movement in the gut, reducing the time stool stays in the bowel. It's important to note that this medication has not been proven to be effective for men with IBS. The recommended daily dosage and optimal timing for taking this medication should be discussed with a healthcare professional. Before you start taking Zelnorm 6 mg tablet, it's important to read the medication guide provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually twice daily, at least 30 minutes before a meal. The dosage is based on your medical condition and response to treatment. It's important to use this medication regularly to get the most benefit from it. To help you remember, take it at the same times each day. If your condition does not get better or if it gets worse, make sure to tell your doctor. Some common side effects of Zelnorm 6 mg tablet may include headache, stomach/abdominal pain, nausea, gas, or dizziness. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential risks. Many people using this medication do not experience serious side effects. During the first week of treatment, diarrhea may occur, but it usually improves as your body adjusts to the medication. If the diarrhea does not stop, it may lead to dehydration. Contact your doctor immediately if you notice symptoms of dehydration, such as decreased urination, dry mouth/thirst, fast heartbeat, or dizziness/lightheadedness. In rare cases, this medication may cause damage to the intestines due to decreased blood flow, ischemic colitis. If you experience symptoms such as bleeding from the rectum, blood in your stools, or new/worsening abdominal pain, stop taking the medication and contact your doctor right away. Zelnorm may also increase the risk of suicidal thoughts and behavior. Notify your doctor immediately if you or your family/caregiver notice any sudden changes in mood, thoughts, or behavior, such as signs of depression, suicidal thoughts/attempts, or thoughts about harming yourself. Seek medical help immediately if you experience very serious side effects, including chest/jaw/left arm pain, shortness of breath, unusual sweating, weakness on one side of the body, trouble speaking, sudden vision changes, or confusion. While a serious allergic reaction to this drug is rare, seek medical help right away if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. Please note that this is not a complete list of possible side effects. If you experience any other effects not mentioned here, contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Zelnorm 6 mg tablet, make sure to inform your doctor or pharmacist about any allergies you may have, as this medication may contain inactive ingredients that could cause allergic reactions. It's important to also discuss your medical history, especially if you have any heart, kidney, or liver problems, as well as any mental/mood issues or stomach/abdominal problems. This medication may cause dizziness, so it's important to avoid alcohol or marijuana, which can increase this effect. It's also important to avoid driving or using machinery until you know how this medication affects you. If you are using marijuana, it's important to talk to your doctor. Before undergoing surgery, make sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to discuss the risks and benefits of using this medication with your doctor. It is unclear whether this medication passes into breast milk, so it's recommended to consult your doctor before breastfeeding while using this drug. When taking Zelnorm 6 mg tablet for irritable bowel syndrome, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's also important to not start, stop, or change the dosage of any medicines without your doctor's approval to ensure the safe and effective use of Zelnorm. If you suspect an overdose or experience serious symptoms such as passing out or difficulty breathing, it's crucial to seek immediate medical attention. You can call 911 for emergency assistance or reach out to your local poison control center for guidance. In the US, you can dial 1-800-222-1222, while Canadian residents can contact their provincial poison control center. This medication is used to treat irritable bowel syndrome, IBS, in women under 65 years of age. It helps to relieve symptoms such as abdominal pain, bloating, and constipation. It is usually taken twice daily, at least 30 minutes before meals. Follow your doctor's instructions carefully. If you forget to take a dose of Zelnorm 6 mg tablet, take it as soon as you remember. But if it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. It's important to store Zelnorm 6 mg tablet irritable bowel syndrome agents at room temperature, away from light and moisture. Be sure to keep it out of the bathroom and away from children and pets. When it comes to discarding the medication, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, consult your pharmacist or local waste disposal company for proper disposal when the product is expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.